While I have always been fascinated by the subject of medicine and the science underneath it, it can sometimes be quite boring if it isn't presented well in court. Let's talk about the examination of the state's pediatrician in this case. Hi, Tony DeWitt here. I'm a Missouri appellate attorney, retired, and I bring you a fresh perspective on the law without offering any legal advice. So pull up a chair. This is what we're discussing today. Now, Dr. Joyce Gilbert is not just a pediatrician. She's a board certified pediatrician. She's involved in several different hospitals. She works in Olympia, Washington, the area where this went down. And she is the director of the what I would call special victims clinic at one of these hospitals. So she knows a lot about the subject. And it is possible sometimes to misuse, if you'll allow me to use that term, it's possible to misuse the medical expert. And one of the ways that you misuse a medical expert is you go into things you don't need to go into, because it gives the defense in this case an opportunity to make you look bad by doing a very clean cross examination that doesn't go into the stuff that doesn't really matter. You also have to assume that the jurors have some level of familiarity with how the body works. And as a result, you don't have to do a lot of what I would call gilding the lily on your examination of this expert. So let's watch a little bit of this expert's testimony, and then I will tell you how I would have done this particular examination based on working for 25 years in a medical negligence law firm where we put on experts every day.
And when somebody is, when strangulation occurs, could the jugular veins be compromised?
Yes.
And how can it be compromised?
A vein is a thin-walled vessel, so it's easy to compress a vein and stop the flow of the blood coming out of the head and down the neck and into the heart. So simple compression will stop that blood, and then it will build up in the head.
Okay. And if external pressure does apply to the jugular veins, where there's compression to the jugular veins, which part of the body is mostly impacted?
The head and the neck region.
I know this may sound like a silly question, but you indicated the head would be one of the parts of the body that would be mostly impacted. Would it be impacted in a positive way or a negative way?
A negative way.
Okay. And why is that?
The blockage of blood coming out of the head causes a backup of pressure in the head, so the blood has no other way to get out except those jugular veins. So when pressure is placed on the jugular veins, that buildup of blood has nowhere to go, and it builds up in the face, in the brain, in all structures of the head.
Okay. And you testify, Dr. Gilbert, that when there is pressure applied to the jugular veins, there's a buildup of the blood in the brain. The buildup of the blood you're referring to, would it be the deoxygenated blood?
Correct.
Okay. And when there is that buildup of deoxygenated blood in the brain, what are some physical symptoms that can manifest?
There's a higher blood pressure in the brain. There is accumulation of the byproducts that should be coming out of the brain, all of the carbon dioxide and the used up chemicals from the brain cells. All of that is being trapped inside the brain and inside the head without the ability to be cleansed and recirculated.
Okay. And when that happens, if a person has a buildup of deoxygenated blood in the brain, what are some symptoms that they may experience?
Many symptoms. They may get confusion. Their brain cells aren't going to think and react appropriately. They will get a headache because that increased pressure will cause pain in their brain. They may not be able to talk clearly or make sense out of what's going on. They get fuzzy. Eventually, they will lose consciousness because of that pressure on the jugular vein.
Okay. And why would the buildup of deoxygenated blood in the brain cause a headache?
Again, the deoxygenated blood, not enough oxygen for each of the cells to do their job, and the pressure of having that extra blood not going anywhere is what causes the headache.
Okay. And why would it cause dizziness?
Dizziness comes from, again, the center part of the brain, the brainstem area, gets dysfunctional, and the brainstem controls almost everything that goes on in our body, our heart rate and our blood pressure and our consciousness and so many things, hearing, speaking. So all of those things are impacted or affected with that buildup of pressure and deoxygenated blood.
The most important part of putting on any expert is preparing them for their testimony. And when I say that, sometimes people think, well, you're telling the expert what to say. No, I'm telling the expert how to focus the information that needs to be presented and how to say it in a way that the jurors will understand. And usually, good experts don't need to be taught this. But experts who don't have a lot of experience testifying sometimes do. And unfortunately, prosecutors who don't have a great deal of expertise with medical witnesses don't understand a lot of this. So the first thing you do is you say, I'm going to take you through your examination. And the first thing we're going to talk about is strangulation. And I'm going to ask you some overview questions. And then I'm going to ask you some questions that deal with physiology. And then I'm going to ask you for your bottom line opinion about whether this could have, if it had gone on, whether it could have killed Fatima. So here's how I would have done that in the context of examining this witness. Dr. Gilbert, what is strangulation? Strangulation is the manual compression of the structures inside the neck, usually by hands or rope or some other thing that completely puts pressure both on the blood vessels as well as the airway. What happens when a person is strangled from the standpoint of the human body? For example, what happens in the venous system? If you compress both jugular veins on either side of the neck, then the blood that's already in the brain has no place to go, and the oxygenated blood that's supposed to be coming up and perfusing the brain can't get in. As a result, the pressure inside the brain goes up, and it can cause things like dizziness and loss of consciousness. Now, if all of that blood is backing up in the brain and it's deoxygenated, and you have all these symptoms where she's getting dizzy and all of that, could there be long-term damage from that? When you shut off blood supply to the brain, as I just discussed, brain cells start dying. They don't all die immediately, but they do die over the course of the next 4 to 6 minutes. And that is what we try to prevent. That's one of the reasons why we do CPR, for example. As a clinician, I would have said sequela, but sequela, that'd be something that the jury would not understand. And you don't want the witness to have to explain all the medical terms. So you just ask, what would the damage be? What kind of damage would be caused by that? And then you go to, if this had gone on for another 30 seconds, what would the damage have been? If this had gone on for another minute, what would the damage have been? If no one had intervened and this had gone on for 5 minutes, what would the damage have been? If the manual compression had gone on for 5 minutes with both the internal jugulars and the internal carotid arteries compressed, there would have been no blood flow. There would have been increasing intracranial pressure. The brain would have received no oxygen during that period of time. You would have started to have brain cells die, and the possibility of resuscitating Miss Fatima at that point would have been approaching approaching zero at that point. And then you cut your examination short right at that point. And I think it's really important when you're doing an expert witness like this that you make it understandable to the jury that you're giving them enough information to understand how bad things happen without going into, doctor, can you explain to me how the mitochondria in the brain utilize this oxygen that's being pumped in through the blood vessels? And why is that bad? Well, for heaven's sakes, do you really need to ask why is that bad? Why is it a bad thing? You don't need to do that. Her examination could have been over much more quickly than it was. And again, it's most likely due to an inexperienced prosecutor, somebody who hasn't worked with medical witnesses long enough to know that they don't need to be led around necessarily by the nose, but you do have to prepare them and you do have to focus them on the end goal, which is this could have killed Fatima. And I just feel like they spend so much time that it's like watching a boring movie. You're sitting in a nice, comfortable chair, and pretty soon you just can't stay with it and you're dreaming about, last night I had chicken for dinner. What am I going to have for dinner tonight? Oh, she's done. What did she say? That's the problem that you're fighting with the jury. Because when you make things boring, minds begin to wander, which is why whenever we have done examinations of doctors, we've gotten the doctor up and had him point to a chart with his little pointer and talk about some of the pathophysiology, for example, in adult respiratory distress syndrome, what happens to the lungs. And you have these anatomical charts, and he points and he explains things, and that keeps the jury focused and involved. But when you're up there droning on with questions about, and then there's no graphics, there's no explanations, you can't see any chart of the jugular veins or the carotid arteries, it is a bad look. And it makes the entire experience for the jury more difficult than it needs to be. And it also can be quite confusing, which is why I always say, confused mind says no. It always says no. You don't want to let the jury get confused because the defense is going to get an opportunity to get up and confuse everything. And you're going to have to fix it after they do. So keep it short, keep it simple, keep it direct, keep it focused. This is not short, simple, and focused. That's all I'm saying. That's what I have for you today. I hope you found it helpful, interesting, or maybe both. If there's a subject you'd like me to discuss, please feel free to send me an email at the address above. If you like what we do, please feel free to subscribe and come on back to the beach tomorrow. I release videos every weekday, weather and work permitting. If you have the opportunity today, do a kindness for your fellow man. It makes the world a better place, one kind act at a time. And now, YouTube has some suggestions for other videos of mine that you might like.